Hello, everyone. Welcome to this Security Risk Assessment Tool webinar. Today's presentation is hosted by the Office of the National Coordinator for Health Information Technology, the Office for Civil Rights, and Altarum. The Office of the National Coordinator for Health IT is at the forefront of the administration's health IT efforts and is a resource to the entire health system to support the adoption of health information technology and the promotion of nationwide health information exchange to improve healthcare. The Office for Civil Rights enforces federal civil rights laws, conscience and religious freedom laws, HIPAA privacy, security, and breach notification rules, and the Patient Safety Act and rule. Altarum is a nonprofit research and consulting organization that creates and implements solutions to advance health among vulnerable and publicly insured populations. Altarum, ONC, and OCR have been working together to improve the SRA tool. I'm Ryan Callahan. I'm a business analyst with Altarum, and I'll be leading today's presentation. We also have panelists from ONC, OCR, and Altarum to help answer questions during our community feedback session. Please note everybody is muted. If you have questions during the presentation, please use the question box in the GoToMeeting interface. And we'll respond to some questions during the presentation and get to some others afterwards during the feedback session as time allows. I want to mention at the beginning of this presentation that this will be the same as our presentation yesterday. If you attended yesterday's session, you will have already seen this. We will do Q&A again at the end of this one, and that, of course, will be different. So the first part of our presentation today will cover some SRA tool basics. We know many individuals who attend these webinars have not used the SRA tool before or may have limited experience with it. If you're already familiar with the SRA tool, stick around to hear some news in the second half of the presentation and to participate in the Q&A. So the presentation today will cover a brief overview of the SRA tool and how to use it, a discussion about our user experience survey, a peek at some enhancements we're working on, and then the Q&A session. Before I get started, there are a couple terms I'd like to define. I'll be using the terms SRA tool and SRA. SRA stands for Security Risk Assessment. So the SRA tool is the Security Risk Assessment tool, and you use the tool to complete an SRA. And then EPHI. EPHI stands for Electronic Protected Health Information. So when I say EPHI, I'm referring to a patient's protected health information. So what does the SRA tool do? The HIPAA security rule requires healthcare providers, health plans, and business associates to conduct a risk analysis and implement technical, physical, and administrative safeguards to protect EPHI. The SRA tool assists organizations in meeting their responsibility to protect EPHI. The tool guides users through an assessment based on the HIPAA security rule. It is a self-paced questionnaire that includes a variety of reports for users to track their progress and assess their security posture. It was designed to help covered entities and business associates identify and assess risks and vulnerabilities to the confidentiality, integrity, and availability of protected health information in their environment. Keep in mind, the SRA tool may not address all risks that are known, and it may not be the only tool you need to conduct a thorough and accurate risk assessment. Risks that are not addressed to the SRA tool must be documented elsewhere. So a little bit about the content. We have a list of these standards here, the HIPAA security rule, HITECH Act, NIST cybersecurity framework, and 3 NIST special publications. All of these were taken into account when developing the SRA tool and its content. What to expect when conducting a security risk assessment using the SRA tool? Many users approach the tool not entirely sure what to expect, and that's understandable. We can't cover everything you should expect, but here are some tips you can keep in mind. The first thing you should expect is to spend a significant amount of time completing your SRA, especially if you haven't done one before. There are many resources freely available to provide guidance, some of which are called out inside the tool itself, but the process still requires an investment of time and effort. In order to complete an accurate and thorough risk assessment, you should understand your IT environment, how it's used in daily operations, and what threats your organization may be facing. It's important to ensure your scope of risk assessment is inclusive of all EPHI in your organization. Healthcare providers who overlook less prominent systems, devices, or applications which can grant access to legally protected PHI may find themselves in an unfortunate situation. So let's talk about how you get the SRA tool and get it running on your computer. The SRA tool can be downloaded from healthit.gov. The file you will download is an MSI installer file. This means that once downloaded, you need to install the SRA tool before you're able to use it. You will download the MSI installer, run through the setup wizard, and at the end of the installation process, the installer will place a blue SRA tool icon on your desktop. This is what you will use to launch the tool each time you want to use it. The tool can be installed on computers running Microsoft Windows 7, 8, or 10, and administrative rights are required for installing the tool, though once the tool is installed, it can be run by any user on the computer. The SRA tool runs from the install location and doesn't transmit any information to the Department of Health and Human Services, ONC, or OCR. Let's take a look at what you'll see the first time you launch the SRA tool. When you first launch the tool, you'll be presented with a welcome screen, which asks you to continue SRA or start new SRA. If this is your first time using the tool, or if you wish to start a brand new assessment, you will want to select Start New SRA. If you select Continue SRA, the system will prompt you to locate and select an SRA file you've already started, and then you can pick up where you left off. The tool will then ask for your name. We recommend using a first and last name, or at least a first name and last initial. This information will be used to keep track of the user who answered each question. If more than one person in your organization will be using the tool, they'll be able to enter their name as a new user when they open the SRA file you're working on together. Before you get any further, the tool will ask you to select a file name and save location for your SRA file. Think of this like a Microsoft Word document. The SRA tool is an application that is used to create SRA files in the same way Microsoft Word is used to create doc files. You're creating a portable SRA file that you'll need to store securely on your machine. Once you've selected your save location and file name, you'll be able to save your progress to that file as you move along through the assessment. Okay, now we're successfully logged into the tool and we're actively working on a file. The first screen you will see is this home screen, which contains some basic information about the tool and is the first time you'll see the left navigation panel and the next button, which should become more familiar as you use the tool. The navigation panel on the left provides some quick access to different parts of the tool and contains buttons allowing you to save your file and log out. Tracking practice assets. Practice information. You'll be asked to document your practice name and some basic contact information. This information will be included in reports generated once you've completed the SRA. If you're completing an assessment for multiple locations, you can include additional location information here. How will you use the tool is up to you, but be mindful of the complexity of the organization being assessed. For example, if your organization is too large and complex for the questions to be meaningfully answered with a single response, You might look to use the SRA tool in multiple concurrent instances. In other words, creating a separate SRA file for each location. Practice assets. This is an area of the tool that can be used to account for IT assets in your organization that have access to or can come in contact with protected health information. What do we mean when we say assets? Essentially, we're talking about all devices that access EPHI. Those which create, maintain, receive, or transmit EPHI must be included. However, even devices that don't touch EPHI can still be compromised and lead to disruptions or further compromise of your systems. So you may find it worthwhile to consider them as well. You can add assets one at a time using the Add Asset button, or you can upload multiple assets using the CSV Asset Template feature. The bottom of this screen shows a table view of all assets listed for your organization. You can click Edit to change details about an asset, and the asset can also be deleted from here. You notice the Manage Multiple link here at the top of the table. That can be used to delete assets in bulk. Here's a closer look at the Add and Edit Assets screen, and we just want to show you what sort of information we're looking for when we're tracking assets. We have the asset type, so whether it's a laptop, desktop, tablet, medical device. Asset status, is the equipment active or is it in storage? EPHI access, we want to track how it interacts with PHI. There are things like disposal status and disposal date. So when an asset is no longer in use, has it been disposed of properly and securely? We're tracking things like the type of asset encryption, who it's assigned to, the location, and finally, there's a comments field to capture additional information not covered by the fields we have. Practice vendors. So your risk surface doesn't stop with your internal IT environment. Your business associates, or those vendors with access to your EPHI, can have insider access to highly sensitive information. Your business relationship with them is a serious responsibility, and the tool provides tracking for those as well. The functionality of this screen is really similar to the asset screen. You can add vendors one by one, or you can use the CSV template. And then the table view at the bottom shows a listing of the vendors you've added. And a bit of a closer look at the vendor add and edit screen. We're capturing things like basic point of contact, address, the name of the vendor. All these can be added and edited here. You can add more than one contact. Some additional notes, I mentioned the CSV templates. These are used to add assets or vendors in bulk, but they're fairly primitive CSV files with column headers. Information needs to be added in accordance with those column headers. So the column order is not flexible. And these are CSV templates. The tool only works with files in the CSV format. So if you're working with these in Excel, you need to make sure that the CSV format is preserved. A lot of times Excel, when you open a CSV file, will ask you if you want to save it as an Excel file, like an XLSX. You'll need to make sure that you're preserving the CSV file format for these to work properly with the tool. Documents. So the final step before you get to the assessment questions is the documents screen. This screen allows you to link documents to the tool. Other sections in the tool also allow document linking, and those documents linked from elsewhere in the tool will show up on this screen as well. Things like privacy policies, security policies and procedures, mitigation plans, and pen test results can all be linked here. Your documents are not uploaded into the tool, but they're linked to locations on your local computer or on your network. Keeping all of these documents linked to the tool is not required, but it can help you stay organized, which is an important part of maintaining your security posture. The assessment. The assessment section of the tool contains 7 sections of multiple choice questions, along with self-rated threats and vulnerability areas and section summaries. The assessment screens are laid out with the question at the top center, answer options below, and education and references panes to the right. The education pane provides guidance related to each response given. So this information changes based on the response you select. The reference panel provides relevant citations to the HIPAA security rule and NIST cybersecurity framework. After you've completed the multiple choice questionnaire portion of each assessment section, you're going to see a threats and vulnerabilities section. You're asked to select from a list of vulnerabilities that may be applicable to your practice or organization. Each selected vulnerability comes with a set of related threats. You are asked to rate the likelihood of these threats occurring and the impact they would have on your organization should they occur. So you see these colored L, M, and H indicators here. In that first example, you're looking at the likelihood of that is low and the impact it would have on your organization would be low. So you're asked to rate all of those threats in that way. Each section ends with a section summary. The section summary shows each of the questions presented in the section, your selected responses, and the related education content. Questions and responses are divided into areas of success and areas for review. Questions that are sorted into areas of success are those which represent a thorough and accurate assessment was completed, and they align with industry best practices. Questions sorted into areas for review represent responses that could use improvement or need to be revisited in order to increase your security posture. As a reminder, questions that are sorted into areas of success do not necessarily indicate compliance with the HIPAA security rule, but rather that your organization is aligned with industry security standards and the recommended actions that help you protect and safeguard protected health information. So once you're done with the assessment section, reports become available. These reports are locked until you've completed all 7 sections, but once you've completed them, you get access to a variety of reports here. So this report is the summary report, and it shows a high-level summary of your assessment results. Important to note here is how your summary scores are calculated. Each summary score is shown in terms of risk percentage. The risk score is a calculated percent of the number of questions that fell into areas for review divided by the total number of questions presented. The 2 other scores seen here are the total number of questions that fell into areas for review, so that's just a count, and the total number of vulnerabilities selected is applicable to your organization. And below, you're seeing that risk score broken down by section. Here we have the flagged report. You may have noticed the flag this question for later response options in the assessment section. Each question you see in the tool has a flag for later response. Questions marked with this response are collected in the flagged report and should be reviewed later. When the flagged report is populated with flagged questions, a red exclamation point will be shown next to it in the left navigation menu. To modify answers shown on the flagged report, you need to go back into the assessment sections where these questions originated. So if you have a few questions on your flagged report at the end, you actually need to go back into the assessment section and find the first one here is in section 3, question 7. You'll need to go back to section 3, question 7 and modify your response there. Once you do that, the question will be removed from the flag report and marked as complete. The risk report. The risk report is a summary of all areas of risk identified in your SRA. This means any questions sorted into areas for review or vulnerabilities you've selected as applicable to your practice. In this report, impact and likelihood ratings are combined into a singular risk rating based on the risk assessment rating key shown at the top of the report. The risk breakdown is a simple pie chart showing the risk level of threats identified during the SRA. The top section of the risk report is dedicated to vulnerabilities, and the bottom section shows areas for review. Areas for review are listed by section and question number. The question, your response, and relevant education information is shown in this report. And finally, we have the detailed report. The detailed report is a collection of all data captured in your security risk assessment. Each question and response, all selected vulnerabilities and rated threats, your listed assets, business associates, and all notes and details captured in the assessment are represented here. This report also serves as an audit log. Each user who contributed to the completion of the assessment will be shown in this report with a timestamp and date of when the question was answered. We recommend saving a copy of this report each time you do an SRA. Now we have some notes about conducting a thorough assessment. We'd like to remind you that this tool is only to assist in an organization with its review and documentation of risk, and therefore it is only as useful as the work that goes into performing and recording the risk assessment process. The HIPAA security rules risk analysis requirement specifies that organizations perform an accurate and thorough assessment of the potential risks and vulnerabilities to all of the EPHI an organization creates, receives, maintains, or transmits. For example, when responding to questions regarding passwords and authentication, authentication should be considered throughout the organization. It is not enough to only consider Microsoft Active Directory password requirements, but organizations should also consider how authentication is managed in other areas, including authenticating to network infrastructure, tools, and devices, authenticating to computer and application administrative accounts, remote work access, etc. The SRA tool may not address all risks relevant to your practice or organization. And use of this tool does not mean your organization is compliant with the HIPAA security rule or other federal, state, or local laws and regulations. If risks are known but not addressed in the tool, they can and should be documented outside the tool and can be linked to the tool using the added document feature or any of the details or comments fields. Okay, that concludes our overview of how to use the tool. Now I want to talk a little bit about our SRA Tool user experience survey. In July of this year, ONC and OCR launched the SRA Tool user experience survey. The purpose of this survey is to gather feedback from users and to help guide the development and future enhancements of the SRA Tool application. The user experience survey asks questions about how your organization is using the SRA tool, tries to find out which parts of the tool might be difficult to use or understand, and asks for open-ended feedback about how the SRA tool could be improved or what new features the tool's users would like to see. We encourage anyone attending this webinar today to take the SRA tool user experience survey. This sort of feedback from the user community is critical to help determine how we can make the SRA tool more effective and easier to use. If there is a feature that you've been wanting to see in the SRA tool, this survey is the best way to let us know. If there are any nagging bugs or annoyances you've noticed throughout your use of the tool, we'd like to know about them here. You may have seen a link to participate in this survey when you registered for this webinar. The link is also included in multiple places in this slide deck, which should be available as a handout. And I think we should be able to post a link in the chat as well. So we've already started, we launched this survey in July, and we've already started to look at some of the feedback from it. And we'd like to show off a few of the new features we've been working on. We hope to add more features as we collect feedback from the user survey as well. So the first new feature that I'd like to talk about is the spreadsheet version. We've received requests to provide a paper or PDF copies of the SRA Tools content since we launched version 3 back in 2019. Now we've had some printable files available since SRA Tool version 2, but we know it's time for an upgrade. We're now aiming to launch an interactive spreadsheet version of the SRA Tools content. All of the SRA Tools 7 sections of multiple choice and threat and vulnerability questions will be accounted for in a single Excel workbook. Responses can be checked and risk scores will be calculated. This will all be very similar to how things work in the SRA Tool application itself. We also think the spreadsheet version will be a good way to provide access to the SRA Tools utility for users of Apple computers, or users who are otherwise unable to install the Windows-based SRA Tool application. Incorporating Hiccup. So we're taking a look at the Health Industry Cybersecurity Practices, or Hiccup, which is the primary publication of the Section 405D task group. We aim to use Hiccup to help bolster the SRA Tools educational content and provide additional references for many of the multiple choice questions presented in the tool. We think the addition of the Hiccup-derived content will provide additional guidance for users and an additional place to turn when they'd like more context for a particular question presented by the tool. You can see in this mock-up here that there will be additional content provided in the education pane, and an additional reference element will be added to the references pane. This content will also be presented in reports, which become available after the SRA is complete. So the risk report and the detailed report should also have this added Hiccup guidance. Next, we have file association. We will finally be implementing file association in Windows. What does this mean? Right now, to open a previously saved file in the tool, you first have to open the SRA tool, click continue, and locate the file from there. After file association is implemented, this operation will be as simple as double-clicking the SRA file wherever it's saved on your computer. So if the file is sitting on your desktop, a simple double-click and you're in. I think this is something a lot of users probably expected from the beginning, and the absence of this feature has admittedly created some confusion on how to open files with the tool. We are happy to be able to include this and hope it will make experience with the tool a little bit smoother. So we have an animation here of just this functionality in progress. To give you a better idea, you can see we've got a list of SRA files here. So all you have to do is double click on that file. The tool will open, and it will open that file right where you left off. And there are a few other enhancements we're working on right now. The first of which being interactive references. Currently, reference elements in the tool are little more than text on screen. We'd like to be able to provide more context for those references and make sure users understand where they can look for more information about a given reference. So we'd like maybe when you click on these references to be able to launch more links, or be a little bit more direct on where you can go for more information. The second thing we've been working on are short instructional videos. We think many common questions about the tool could be answered best through short demonstrations. So whether it's how to print a report or how to load an assessment from a previous year, we think short instructional videos will be helpful for a variety of users. And then easy access to help. Early reports from the SRA Tool survey indicate that a lot of users don't know where to go for help with the tool. So we'd like to provide more links inside the tool to help users and extend a knowledge base on healthit.gov to help users get support with their SRA and the SRA tool. So that concludes the prepared overview portion of our presentation. And now we're going to open up the webinar for questions and answers. We do have a few of our common frequently asked questions here that I'd like to go over before we get to questions from the audience. So I'll go ahead and start with those. So the first question we get a lot is, will the SRA tool be made available for Mac OS or iOS? The answer is no, not at this time, but it's a frequent request and it may become a priority in the future. Currently, if you go to healthit.gov to the download page, you will see under the legacy heading, says legacy version heading, there is what we call the paper version. It's 3 Word documents. You know, if you're unable to run the tool for whatever reason, if you're using Mac OS, you can currently download those. But the planned spreadsheet version of the tool, we think will also be a good option for users of Mac OS. Does the tool support being saved on a network file share? Yes, it does. So if you want to take your SRA file and put it on SharePoint or some sort of shared network resource, that should work fine, and multiple users can access that file. You know, so you can, as long as you both have the tool installed on your machines, you can open the file from that shared location. The only catch is you can't work on it. 2 people can't work on it at the same time. Kind of have to take turns. Can I import an SRA from version 3.0 or 3.1 into version 3.2 and beyond? Answer is yes. Anything created by version 3.0 is compatible, but SRAs from SRA Tool version 2 are not. So those are getting quite old at this point. SRA Tool version 2 hasn't been around for a while. You know, there is a chance that somebody could have SRAs from SRA Tool version 1. Neither of those will be compatible with the current version of the tool. But anything that has a version 3 or beyond should be compatible, and we intend to keep that compatibility going forward. Once an SRA is complete, can you enter what your plans are to mitigate, or do you need to print the results manually and write in your process? So documents can be linked to your SRA tool, and there are also notes fields present on each multiple choice question and in each section summary. So I think if you're going to document your mitigation plans, it is a great idea to attach them using that documents feature, or at least make note of them in those comments fields. And we also plan to have a space for notes in the spreadsheet version. Are remediations for the practice supposed to be done on your own outside the tool? Yes, remediations are to be done outside the tool. However, you can document them, that your remediations have been complete in those notes fields, and you can attach remediations using that document leaking feature. Will the SRA tool be supported in Windows 11? So Windows 11 will be launching next month, pretty shortly here, and we do anticipate that the tool will work in Windows 11, but you know, as soon as it's released, we'll be working to address any issues that may arise in the next release of the tool. But we don't anticipate much issue. We do think it should be able to run in Windows 11. And finally, given that we teased some of those enhancements, when will the next version of the SRA tool be released? Unfortunately, we don't have a release date for the next version of the tool at this time. Some of that is going to depend on our findings from our user experience survey. So we want to get some worthwhile enhancements from our user feedback to incorporate into the next version. But we'd ask that you follow along with updates from ONC at healthit.gov and subscribe to the OCR listserv. Here on this slide, there is a link to subscribe to the OCR listserv. And if you want to subscribe to email updates from ONC, you can just go to healthit.gov, scroll to the bottom of any page there, and you should see this stay connected with ONC, subscribe to email updates. If you put your email address in that box and click sign up, you'll be subscribed to email updates there. And just as a reminder, this slide deck is available as a handout. So if you want access to these links, you should be able to grab that handout and get those links there. So that's all the FAQs I had lined up. I think we're going to take a look at questions from the audience. I'm not sure if we've lined any questions up. If Andy or Nick have some?
I see one here. I can kick us off. asking about a law signed in January provides audit relief and penalty consideration for covered entities and business associates to implement the NIST cybersecurity framework, and whether the tool be updated to include alignment with the NIST cybersecurity framework. And I believe that's referencing HR 7898, which was signed into law earlier this year, and directs the Department of Health and Human Services to consider whether a covered entity or business associate has implemented recognized security practices for at least the prior 12 months, which may, emphasis on may mitigate fines, result in early favorable termination, mitigate other remedies. And specifically, they reference the NIST cybersecurity framework and the health industry cybersecurity practices. So the tool already includes references to the NIST cybersecurity framework. And as Ryan, as he stated, we're going to be updating to include references to HICCUP, or the health industry cybersecurity practices. So the tool will help organizations, it will be a useful tool to help organizations align with those frameworks. And there is, as stated, that added incentive to do so from the law that was referenced. So that was one question I wanted to answer live. Don't know if there are others that maybe Nick wants to answer.
Yeah. Yeah, Nick, do you have any lined up, or?
Sure, there's a couple here, Ryan. Thanks for that. So my name is Nick Heasters. I'm with the HHS Office for Civil Rights, and there's a couple questions here that I can share with the group. But one thing I will say is that the policies of OCR are published on our website in the form of our FAQs and guides and rules and regulations. So anything I speak to here are my own personal opinions and do not reflect policies of the OCR. Just a couple of questions that we had here. There was, I think this was already addressed maybe in a couple times about Department of Labor cybersecurity guidelines being referenced, and Ryan or Andy, if you wanted to say anything more about that, but I think the answer is no. I think Andy already said that the NIST cybersecurity framework and the security rule are considered within the tool, and that a future revision should also include the health industry cybersecurity practices, or HICCUP, some of the output of the CISA 405D Cybersecurity Act of 2015. One question, this kind of comes up, came up yesterday as well. How often is it required to do a HIPAA SRA? So there's not a prescribed period of time to under the HIPAA security rule for conducting HIPAA security risk analysis. What is required is that all parts of the security rule are reviewed, including the risk analysis, are reviewed periodically and are updated as needed in response to environmental operational changes that are going to affect the security of the EPHI of the organization. I would encourage folks to, if they're going to use this tool or any tool, for conducting a HIPAA risk analysis, to do it in conjunction with our risk analysis guidance, which is available on our website. So the guidance talks a little bit about periodicity for the tool. So the regs indicate what I already said about the periodic nature with respect to updating in response to environmental operational changes. One thing that the guidance talks about, they talk about maybe more best practice, but a truly integrated risk analysis and a security management process would be performed as new technologies and business operations are planned. Thus, that would reduce effort required to address risks that are identified post-implementation. So it's suggesting to integrate a risk analysis process, with your overall business processes. Another, I think a second part of that question was about what else needs to be covered that is not in the SRA tool. The requirement under HIPAA is that the security risk analysis be accurate and thorough. So the tool attempts to do that in as best as it can. It's a questionnaire-based tool. But there are some things that, and I think Ryan pointed this out, that there are features of the tool. There are some free text box to be able to describe your assessment of different areas of the questionnaire to ensure that the identification assessment is accurate and thorough. There are opportunities to link to external sources and documents from within the tool to help to demonstrate that accuracy and thoroughness. Obviously, you know, the tool is questionnaire based, so it doesn't do things like identify technical vulnerabilities. The risk analysis guidance that I referenced on our website, it does talk about identifying technical vulnerabilities as well as non-technical vulnerabilities. So technical vulnerabilities being defined within guidance as holes, flaws, weaknesses in information systems, incorrect implementations, misconfigured systems, you know, things like that. So as Ryan mentioned, if there are opportunities to, however an organization may decide to identify those technical vulnerabilities, you know, that output showing that that's been done can be linked into the tool to show that accuracy and record that. What else do we have here? Is this compatible with the PCI industry? You know, Ryan or Andy, I'll maybe ask you to speak to that a little bit, but you know, I don't believe that PCI requirements were under consideration with respect to the tool. And just one more question before I turn it back to you guys. All right, two more questions. Will OCR consider in its enforcement capacity? There was a similar question yesterday, and I'll just, you know, kind of repeat that answer. So again, so the question is, will OCR consider the implementation of this new tool and mitigation efforts in its enforcement capacity? And I think it was already stated in the within the presentation that this is a tool. It's not a required tool. The security risk analysis is required under the HIPAA security rule for HIPAA regulated entities, but is not required to use this tool. The tool is designed for use by, you know, small or medium-sized organizations. And the tool in and of itself, you know, just by using the tool, it's not a, you know, quote unquote, get out of jail free card. The tool, any tool, any risk analysis takes work. It takes an analysis of your systems. It takes understanding of your systems, how EPHI gets into your systems, where EPHI goes in your systems, how EPHI exits your systems, and what are the risks to EPHI throughout that life cycle. And the tool attempts to guide the users through that process by recognizing common risk areas through that process. But as I said before, you know, there are things the tool doesn't do with respect to technical vulnerabilities, and there may be, you know, other risks that are specific to an organization that are not elicited within the tool that the organization should take note of and identify and assess and document and mitigate. And again, leveraging the linkage of the tool that can be appropriately linked in there to show accuracy and thoroughness. So, you know, OCR will consider, you know, this tool or any tool or methodology. We do not prescribe a particular tool or methodology for the risk analysis, but whatever is done has to be accurate and thorough. It has to apply to all the EPHI in your organization, and it has to show that accuracy and thoroughness has been done. And this tool or any tool is only as good as the work you put into it. It's a garbage in, garbage out type of situation. If you don't put the work into it, if you're just going to say yes, no, yes, no, yes, no to every question, that's not going to show accuracy and thoroughness of assessing the risk to EPHI in your organization. What else do we have here? I'm using a third-party vendor to do risk assessment. They provide us with questions. This is probably insufficient to assess risk. If we do the SRA, we consider that. I think I just answered this basically in the prior question about, you know, what is the adequacy of this tool versus other tools. So, I mean, I can't speak to this specific issue or question or from the OCR investigator, so I don't really know the circumstances and can't really talk about specific cases anyway. So all I can say is that you know, the rule says it needs to be accurate and thorough, and it needs to address the risks to all the EPHI that the organization creates, receives, maintains, or transmits. So Andy or Ryan, if you wanted to maybe say anything else about the PCI question, I kind of hung it out there a little bit.
Yeah.
Yeah,
I'm not, oh, go ahead, Andy.
I was just going to say, I mean, we didn't take into consideration specifically anything from PCI or the Department of Labor cybersecurity requirements. There may be some overlap incidentally, but it would be incident. I would not look to this tool as a resource specifically for those, but then again, it may overlap more than I'm thinking. So long story short, that was not intended to align with either of those frameworks. There's another question here about having a catalog of HIPAA assessed third parties. And so I'm not sure exactly what would be meant, what's meant by HIPAA assessed third parties for health industry covered entities to review a list of approved vendors. To my knowledge, there is no such public resource that exists. Certainly, third parties or business associates may be audited or investigated for HIPAA compliance, and there may be some enforcement actions that are public information in that sense. But if you're looking to understand which vendor may be a business associate, the HHS website and their resources includes a decision tree to walk through the logic of which vendors or third parties would be considered business associates. So you may find that helpful, but there is not a catalog of business associates who've been assessed as such.
Andy, I can take some if.
Yeah, go ahead.
Okay. So somebody asked, is there a way to see a report that shows changes from questions from year to year, or do we do an annual assessment? This is a good question. We always get questions like this, and I like to try to address them. So we find, of course, a lot of people are doing their SRA each year, and they're using the SRA tool to do it. And I guess, I think there are areas for improvement with the tool in this regard, and we definitely like to hear more feedback on this. But currently, if you're, let's say you have your SRA that you completed in the tool from 2020, and now you're trying to look at it again in 2021, if you open up that previous file in the tool, you can use the Save As feature and rename that file to your 2021, SRA 2021. And then you can sort of go through and review previous answers and make changes and add things to that. And we think that's a good way. You need to look through all of your answers from a previous year, but that way you don't have to start over from scratch each time. And I think this question is specifically asking about a report that would show changes year over year. And that's something that we don't have, but I think that's a good suggestion. And something that we could potentially put on the backlog for a future enhancement, something we could look into for sure. I have another question about, is there an API available to integrate into other systems? So the short answer is no, but I just want to state that the SRA tool is something that runs locally on your computer. It's not connecting to the internet. It's not connecting to any other systems. You install it on your computer, your SRA file stays put, and so we're not allowing. There's no connections. There's no API integration in that way. Asking about the tool available for Linux, the answer is no. Like Mac OS, we do not support that with the software tool right now. However, there are the legacy paper documents. Actually, I think there's another question about where can we download the Word documents. If you go to, it's healthit.gov. If you go to Google and type in SRA tool, it's usually the first result. It'll take you to the download page. On that page, you'll see there's a heading that you will need to click on and expand. It's called, I think it's called Legacy Version. Under that, there are 3 Word documents that have content from SRA Tool version 2. Now this is still valid to use, but full disclosure, it's not it's not the most user-friendly thing, and that's why we're turning focus to this Excel version, which unfortunately I don't have a release date for. But I would expect it. We're not looking at like years before it's released. We're looking at maybe months here. So that's about all I could give on that. Let's see. Can an inventory of assets be uploaded into the tool rather than manual entry? Yes. So I did get into this a little bit in the presentation. I was talking about the CSV import features. So you can download. The way this typically works is you go into the tool to like the assets page, and you click download asset template. This will give you a CSV template file with column headers showing where you need to put your asset IDs, where you need to put the names and the asset types and all that. It's all laid out in those columns. So you can enter in manually or paste in a list with the columns in that rigid order. They need to follow the same order as the template. Save that save that CSV file, and then you can upload that into the tool. And so you can kind of upload bulk assets into the tool all at once that way. Now, maybe this is a good opportunity to touch on, if you want to do that in all scenarios. And I think, the bulk import is a good feature, but, if you're working with thousands of assets, for example, there may be better ways to track those assets. I mean, it's certainly possible, but you'll have to consider that for yourself, depending on how many assets you're working with. Let's see. I had a couple others flagged here. I'm not sure. Did Andy or Nick, did you have any other questions you wanted to get to?
This is Nick. I didn't see any new questions, but maybe I can just touch on something that Andy said earlier regarding certifications. And the omnibus rule, the OCR put out in 2013, does talk a little bit about certifications. In there it says that the department declines to establish or endorse certifications for HIPAA compliance. It talks about how those services, may be useful tools for certain entities, depending on how rigorous those compliance programs were. However, it also went on to say that certification does not guarantee compliance, and therefore entities that are certified may still be subject to enforcement by OCR. So it's just wanted to, just kind of make that clear. And maybe just another thing I can just emphasize, give another example of I mentioned this example yesterday, just going to the accuracy and thoroughness. How can you show that, or what's an example of being able to show that? One example could be, how is, an example of protecting EPHI from unauthorized access. What processes are in place for, authorization and access controls. And when there are questions, surrounding those types of topics within the SRA tool or any tool or risk analysis, that it needs to be holistic in nature to understand the, not just authentication within an Active Directory environment, that a response, to consider the strength of authentication processes should not end at the AD environment and just, what your rules are for that, but, what are your rules for elevating access to a privileged administrator? Are there specific controls around that? Are there specific password rules around that? Is there a specific privilege escalation tool that's used to control that? Are there different password rules for administration tools that are used by the IT department to manage the infrastructure that supports the EPHI and makes it available for users? Maybe things like the administration tools to manage the virtual machine environment. tools that are going to manage the SAN environment. What are the authentication schemes that are used for remote access into the organization? Are the relative risks of local access and administrative access versus remote access, are those varying and taken into consideration with respect to the final authentication solution that's put into place to mitigate those risks? What are the, and not only the, administrator from an AD perspective, but administrator for an application, for your SA user in your database, for your root user in your Linux or Unix environments. So all these things need to come into consideration as far as how these different schemes of ingress, of authentication, of escalation of privileges, how they occur in your environment, how they impact the risk to the ePHI, the integrity, availability, confidentiality of ePHI, and how they're assessed, and what are the controls, the tools, and security measures that are put into place to reduce these risks.
Okay, so we're nearing the end of the hour here. I wanted to take the opportunity again to, we couldn't get to every question. I think there are some more still hanging out there, but if anybody here has feedback specifically on the SRA tool or the survey or really anything, you can, first of all, please take our SRA Tool user experience survey. There are links to it in this slide deck. There is a free text section at the end where you can, give us ideas for enhancements that we can make to the tool. And there are some multiple choice questions just to rate your experience with the tool in there. If you still have questions or comments, we do have the SRA Tool help desk at altarum.org, and also the Health IT feedback form on healthit.gov. Those are available, and we can try to get to any questions we were unable to answer today in those places. And let's see. We have another slide here with just some additional resources. The user guide is a great place. If you have questions about using the tool, that's available on the SRA Tool download page. I also want to call out the links to the listservs mentioned earlier in the slide deck. Those are great places to keep up to date on the SRA tool and find out when enhancements are released. And I think that's all we have for today. So I'd like to thank everybody for attending, and send us the feedback via the survey, and let us know at the help desk if we can help answer any of your questions about the tool. Thanks, everybody.